I am Justa Ortita Encarnacion, Commissioner of the Virginia Department of Health, and welcome to Step Into Wellness. This is your invitation to embark on a meaningful journey to better health. Today, life moves so fast. The demands on our time and energy are endless, and we often prioritize everything but our own well-being. Chronic diseases such as heart disease, diabetes, hypertension, behavioral health, and cancer are affecting millions of people globally. The impact seen is not just physical, it is also emotional, social, and financial. The good news is that many of these diseases are preventable, and their effects can be managed through lifestyle choices and informed decisions. Throughout these series, we will take a closer look at chronic diseases, explore their causes, effects, and most importantly, the steps you can take to prevent or manage them. Our goal is to empower you with the knowledge and tools you need to take charge of your health and well-being for the long run. So I hope you are ready for the journey. September is Prostate Cancer Awareness Month, and so begin today, we will focus on prostate health and why men, especially Black men, should care. So men, don't you dare swipe that screen. Dr. Emmanuel Graham of the Graham Neurological Center on St. Croix joins us for this conversation. Later, we will hear from the Department of Health's own Janice Valmont, Deputy Commissioner of Disease Prevention and Health Promotion, and Linnea Fredericks, Director of Chronic Disease and Prevention. Dr. Graham, good evening. So, Dr. Graham, September is Prostate Awareness Month. Tell us some of the risk factors that are involved in prostate cancer.
So, September is Prostate Cancer Awareness Month, and it's an important issue for, men and women in our community. And with regards to the risk for prostate cancer, the first obvious risk is being male. And so any male should at some point take this into consideration. Other risk factors involve family history, so knowing what your father, grandfather, uncles have experienced, or their health history is also relevant for that. Those are the main, risk factors.
But it seems to increase with age. Why?
Prostate cancer is very slow growing. And so most of the times when we find it, most patients are over the age of 60, 65 in that range. And so that's typically when we find most of the cancers. However, there are times when we find prostate cancer in younger men in their 40s, but those are very much more aggressive forms of the cancer.
So when should they actually start doing the screening?
Screening is an interesting dilemma. It's gone through many different recommendations over the years from the U.S. Preventive Task Force and the National Comprehensive Cancer Network. The bottom line is that for a community like ours, predominantly Black or African American, it's considered a high-risk community. And so it's important to know that you can't always extrapolate the data from these national studies that may not account for the uniqueness of some of the population. And so the recommendation at this point is men who have a family history, first-degree relative, should actually start screening closer to their 40s. And if they have family history of breast cancer, colon cancer, ovarian cancer, pancreatic cancer, any of these other cancers, even though they're not primarily prostate in nature, it increases the cancer risk overall. And so it's important to get screening anywhere from starting at 40, 45 range, and then every 1 to 2 years after that up to 70 or 75.
So that's why family health history is so critical. And because most men wouldn't think, well, I have to worry about prostate cancer because my mother had breast cancer or ovarian cancer or my aunt or my grandmother So that's an excellent point. So thanks for sharing that.
Yeah. So that way, we're not just in isolation thinking I'm okay because there's no prostate cancer. That's being health focused and being aware of what's happening in your family that may increase your risk.
So when I started and I said, you know what, men don't swipe or don't touch the screen, I said it because for some reason, especially Black men and Hispanic men, the thought of what the screening is scares them. Tell us a little bit about what the screening is and how people could become a little bit more comfortable with it.
Okay, so the first point to note is that a lot of men, and some women, but mostly men, just don't want to know what's wrong. And that's at the basic level. We don't want to know that there's a problem, because now it might create a change in lifestyle and so forth. So a lot of patients don't come in for the screening for that purpose. The two best tools to evaluate for prostate cancer or to screen for prostate cancer is actually doing a simple blood test called a PSA, and then doing a prostate digital rectal examination. It's the digital rectal examination that really is the thing that is the most unpalatable for most men. However, I try to explain to them when they come in for, shared decision making and counseling on this issue that there are a lot of times when we find cancer in the prostate on the exam, even though the PSA is normal, because the more aggressive the cancer is, sometimes the less PSA it makes. So you can have a normal PSA and you can have a really abnormal exam. And so that's where the importance of that exam is.
And the fear a lot of men have with the rectal exam should really be attributed more to the results. So the rectal exam is a tool for diagnosis. If you don't have that early enough, the more fearful aspect of having a positive result should be considered.
It should be, absolutely. And so, we just try to encourage patients to do what's, the best and what the standard of care is, and not half do an evaluation and feel comfortable about it.
What type of treatments are really available for individuals with prostate cancer?
Over the years, the oncology or cancer community and the urology community have made great strides in the treatment options for low-risk prostate cancer. Most patients actually live normal, healthy lives. Anything from observation, not because we diagnose cancer means that we have to treat it. So we observe patients. And then there are things like robotic surgery, minimally invasive treatments, freezing the prostate, or using focused ultrasound waves to treat the prostate. And most of these things are very well tolerated.
Dr. Graham, one of the things that, especially for the younger men that needs to grow and learn, and for women as well, tell us where the prostate actually is.
So the prostate is located right at the base of the bladder, or between the bladder and the penis, in that area, and it's really important more so for reproduction. The PSA is a reproductive protein that's secreted by the prostate, and it helps to liquefy semen, meaning it makes the semen thin so that the sperms can swim and accomplish its goal. And so that's the relevance of the prostate. It also plays a role in urinary health and continence. And so, but the most important thing to realize is that most men who are diagnosed with prostate cancer feel completely fine. They have no symptoms at all. They feel great. It's true decision making, evaluation, screening, recognizing their risk factors is how we're able to find that they have cancer.
So one of the things I want to touch bases, and it's not prostate per se, but I want you to talk to the younger men as well, because prostate cancer, especially over the age of 40, is something we're concerned about. But I'm going to shift it to testicular cancer for just a second. who should be concerned of testicular cancer, and what age group are we looking at in terms of the higher rates?
So there's what we call a bimodal distribution. So you have testicular cancers that are very common in younger patients, teenagers, and then it kind of skips the middle age a little bit, and then starting at 60, 65, then it increases quite as well. It's extremely important. I'm glad you brought that up, just to have the opportunity. It's extremely important that teenagers check their testicles at least once a month. When they're showering or something, they just make sure that there are no changes, no hard areas, lumps, swelling, anything that's unusual. Because most patients who are diagnosed with testicular cancer, they catch it themselves. It's not they go to the doctor and get an exam. They actually come to the doctor saying something is wrong. And so it's really important.
So you can correlate that with breast cancer. You actually, a lot of individuals diagnose that themselves, even though we know this is Prostate Cancer Month, and not every month belongs to women, but I think it's important to have that correlation, so to let people know that it's important. So I brought the testicular portion up because I want you to speak to the wives, the girlfriends, the boyfriends, and what can they do to help prevent or to early diagnose cancer, prostate cancer, testicular cancer?
Cancer is a familial thing. It involves everyone in that household. So it's never in isolation. So women or men in a patient who is at risk for prostate cancer, they should just try to encourage them to be healthy, to eat healthy, to think about the choices that they're making, and to be health conscious. That beginning step is then going to transition into, well, maybe I should get my screening done. I'm already thinking about eating healthy foods and living a healthy lifestyle. And so just that encouragement, the gentle nudging, and sometimes if you have to drag them into the doctor's office, that might be necessary, but just that continuous encouragement, I think, goes a long way.
Later on, we're going to be speaking to Director Linnea Fredericks, who has her PhD as well. And so one of the things that she always talks about is the fact that good nutrition decreases the risk factors in that. And I know you just spoke about that as well. So we're going to link that as we continue the conversation. So thank you for actually addressing that as well. I want to make sure that you give a review to the public in terms of cancer. Let's go a little bit step further. Let's talk about behavioral health issues. Because every time that you're fearful to go to get the exam, and let's say you go and you do your PSA, but then you realize that you actually do have cancer. In your business, how do you incorporate behavioral health factors into diagnosis of cancer?
So it's important that usually when we're giving patients a diagnosis of cancer, we try to have, a wife, girlfriend, boyfriend, some family member, cousin, whoever is their support system available to hear what's going on and then to be able to support them in this life-changing, diagnosis. And so we always try to be mindful of the impact that just those few words have on people's lives, and to try to incorporate that into the way that we, manage.
And the reason why I went there also is because, just like Black and Hispanic men don't like to really think of the digital exam, they also don't like to think of behavioral health as an issue that they want to face. And that combination of both, and it can be very scary. Right. So it's good to be able to have that conversation. Talking about it is important. That's just definitely. Now, we're hearing that you have a event coming up soon. Tell us a little bit about what you're doing. So
on September 30th, on this Saturday morning from 9 a.m. to 1 p.m., we're just, celebrating prostate cancer awareness, trying to get the word out that prostate health, prostate cancer is an important issue. And we are offering free screening. So PSA blood tests and the prostate exam for patients who want to do so. And we're just trying to make sure that they understand that this is something that we need to continue talking about, that we need to raise awareness about, and encourage folks to be able to get evaluated.
And don't be fearful of it. Remember the time that we actually it was downstairs in close to emergency room.
Yeah.
And we had...
That was in 2009.
Right. And we actually brought other physicians in, and we had a long line of men lined up to do both.
Yeah.
And at first they were like, okay, we're going to do the blood. And we were like, no, you're doing both.
Yeah.
And they were like, and they were laughing in the line, but they didn't leave the line.
Right.
So we had over 300 individuals that had their tests done on that day, which was wonderful.
It was a very successful event. And so, I just try to encourage men in the community to know what's up and to...
Well, I love that. And really and truly go out. Where is it going to be again?
It's right next to T-Mobile, which is in Peters Rest, across from Plaza East and Cost-U-Less.
Okay, before you leave, just give us a recap. Prostate cancer, talk about testicular cancer, but give us a recap of what's happening this month, why it's important for us to remember prostate cancer and what it's all about.
So prostate cancer is the leading diagnosis of cancer in men, and it's also about 1 in 6 to 1 in 8 men would develop prostate cancer in their lifetime. That's a significant number.
Yeah.
And anywhere from 2 to 3% may die from prostate cancer. So it's not insignificant. And so, and it's even more significant in high-risk populations, like I mentioned. So, being able to screen and raise awareness for prostate cancer is very important to our community.
You alluded to something. It's a little risque in terms of conversation, right? But you alluded to something. If someone has prostate cancer, they may have to have surgery. Is there a concern in terms of their sexual ability? Is that what you were alluding to?
Yeah, so, that's one of the, major discussions that you have with men about the treatment options. And for some people, depending on where they are in their relationship, sex is important, and others it's not. And so you can't make that determination for them. So we give them the information, and then they can decide how they want to proceed with it. But the treatment options that we have now really move towards sparing the nerves that would preserve sexual function even after diagnosis and treatment.
So even though it's scary, because of the new advances in healthcare, the prognosis is
very
better.
Good. Very good.
As well as the function and ability is better as well.
Yes.
I think that's wonderful.
Yeah.
Thank you. Like I said in the beginning, I say it again, it's been a pleasure.
A pleasure is mine.
Sitting on here talking to you. Congratulations on what's happening this weekend and on the affair that you're having. I wish you much success, not only today, but always in your future. So thank you for being here with us. And before we go, I want to remind you that Dr. Valman, as well as Dr. Fredericks, is going to be here speaking with us. You hear a little bit about what we're doing in the Department of Health in reference to cancer, prostate cancer, and other cancers as well. So don't go away. See you soon.
I am Eustace Grant Jr., also known as the Dundee. I was diagnosed with stage 2 prostate cancer on August 31st, 2017. That moment changed my life. The hardest part of the experience was the thought of not being here to see my children and grandchild grow. Luckily, my family and support team were real. They had food sales to show their support. My prayer warriors and doctors were phenomenal. Do I encourage men to get screened for prostate cancer? The answer is an absolute yes. If you're an African American male with a family history of prostate cancer, you should begin screening at age 40. If you are unsure about screening, talk to your doctor to decide if screening is right for you. This message was brought to you by the Department of Health, Division of Chronic Disease and Prevention.
Welcome back. I want to take the time to actually reflect on the video that everyone just saw. And that's Eustace Grant Jr. His nickname is Dundee. And I really want to congratulate him and thank him for sharing his information, looking at prevention, looking at treatment, and of course a cure, and looking at the elation that he felt with his family being able to have him in his life for a little bit longer. So I really wanted to say thank you for allowing us to present the video to the community and for them to learn from you as well. So thank you. Here with me right now is, of course, our director. We have two people from the Department of Health here. Dr. Janice Bamand is our Deputy Commissioner of Health Promotion, Disease Prevention. And of course, Linnea Fredericks, our Director of Chronic Disease and Prevention. Welcome to both of you.
Thank you.
Thank you.
I'm going to start with you, Dr. Valmont, because I know that both you and Dana Christensen, our former Congresswoman, worked very hard on really revamping our strategic plan. We have a mission. We kept our mission with an addition of one word coming up. But tell us a bit. Tell the community, what is our mission in the Department of Health, and how does it link now to what we're doing?
Thank you, Commissioner. And it's always an honor and a pleasure to talk about public health and to talk about the mission and the vision of the Department of Health. So we embarked on a very comprehensive process, and the mission that we adopted, which actually everyone voted on and kept the one we had before, to reduce health risks, increase access to quality health care, and enforce health standards. What we did was develop a broad vision for the department, which says that we want to see a trusted system that supports a healthy Virgin Islands. And I'm very intentional about reading this from this document, because as part of the process, and again in response to actually Governor Bryan's Healthy Horizon initiative, he challenged us to develop a territorial health plan.
Right.
So which we did. And the Healthy Virgin Islands 2030 is where we are creating a roadmap for public health for the territory.
And it wasn't a simple task.
No.
So we actually did an assessment first.
Correct.
So what was that process like?
The process was extensive, and we started right before COVID, and not to be derailed by the fact that we could not use our initial plans of having focus group discussions and town halls and key informant interviews. We worked with ASTO, the Association for State and Territorial Health Officials, to develop a needs assessment that use secondary data, that means data that already existed, and as well as conducting a survey of the community. And we were really pleased and impressed that over 500 individuals answered that survey and gave us a lot of input into helping us select the priorities for health.
We speak a lot about social determinants of health. So in that process, we were able to establish what are the local social determinants of health, which is so different a lot of times from our mainland partners. Correct. Or our other Atlantic partner and our Pacific partners. Right. So our island affair partners, I could say, right? So good.
Correct.
So, but we do have a link to this month's prostate cancer. So what is that?
So one of the priorities in our Healthy Virgin Islands 2030 is to address chronic disease burden. Goal 2.3 is, guess what? Reduce mortality associated with cancer. And the first objective that we selected was to reduce mortality associated with prostate cancer.
And why was that so? In terms of the data that's showing, what is our data showing, Dr. Fredericks?
Well, first of all, thank you for having me. Happy to be
You're
here.
not a medical doctor, right?
No, I'm a PhD, the other doctor. But the data shows that prostate cancer is the most commonly diagnosed cancer in the territory. So, I mean, it has the highest incidence. So that is very fitting. I'm not sure if you had that data at the time, but good choice. But yes, that's as new as our 2017 data shows it. And we expect to see that trend because data doesn't change so much over year-to-year basis. So yes, that's a very, very timely objective. And in the Division of Chronic Disease and Prevention, we recognize that, and we are working with our partners to address prostate cancer. And Dr. Graham, who was previously here, we collect that data from him specifically because he collects a lot of the data, treats a lot of the patients for prostate cancer. So he gives us that data, and then we're able to report it to the community.
Excellent. No, we've been talking a little bit more about data and looking at insurance. And one of the things that the community has actually brought to my attention is that we look at data from our cancer registry. However, the cancer registry focuses on we look at diagnoses made within a territory. But a lot of our individuals, a lot of people leave the island and they're diagnosed outside of the island. They're treated outside of the island. We're trying to help that. We're trying to really reduce that transfer off island. But what happens is that we don't account for the cancer that's off island, that's diagnosed and treated. So,
well, there's a catch-22.
Okay, good. Tell us about it.
So as through our CDC funding, we're tied into other cancer registries, state cancer registries. And with that linkage, we share data. So we have a data sharing agreement with other states. However, the patient has to list the U.S. Virgin Islands as its primary address. If we're listed, then they send us the data, and we do the same for other states. If you don't list U.S. Virgin Islands as the address, we have no way of getting that data, unfortunately.
Okay. And so that's an ask to the community.
Absolutely. Absolutely. And I know people make that determination based on social factors, but if you list USVI as your primary address, we will get that data. And we need that data to show what our true incidence is, because, of course, then it's going to be higher than what we're reporting.
And, of course, if it's linked to your insurance coverage, a lot of times you have to put the VI as your coverage area if it's linked to your insurance. So that's one of the things. So that's excellent to know, because a lot of the conversation or questions have been coming up to us more and more and more. Tell us a little bit about your division. Well, let me just brag a little bit, okay? I said this all the time. I actually met a cousin of yours when I was visiting DC within the last week.
Nice.
And he said, I'm Dr. Frederick's cousin. And I was like, oh my gosh, she's one of the best. And he's like, you told me that the last time you spoke to me. I said, it's true, but you have taken chronic disease and health promote outside of the box. Congratulations, really and truly. I don't just say this lightly. I said it wholeheartedly. Dr. Vermont, I know you are proud of the division, where you're assistant to take us. So tell us a little bit about what you do in the division and how it impacts cancer as well as other chronic diseases.
Sure. So we do a lot. As you know, chronic disease is vast. So we can't cover everything, but we look at the data, and that's how we decide on what our priorities are. So what we focus on in chronic disease right now, cancer, of course, tobacco, and then we focus on the risk factors for chronic disease, which includes tobacco, obesity, nutrition, physical activity, and then other chronic diseases such as diabetes, cardiovascular health, stroke, sickle cell, and then we have rape prevention and education. So that sounds like outside of chronic disease, but it still falls under chronic disease. So
it does, because it has a behavioral health impact.
Absolutely.
And people don't think that way. But once you have an incident like that, you live that for the rest of your life. So that's the behavioral health impact as well as physiological impact, because infectious diseases actually can ensue as a result of that. So there's so many things, and pregnancy, so there's so many things that we're looking at. So thank you for that in reference to what you're doing in your area. Now, let's go back to cancer in specific, especially prostate cancer. What are you doing right now to assist with the recognition of prostate cancer in your division?
Well, first, we're having an event. On October 14th, we're having a prostate and breast cancer ceremonial walk. So we decided to combine the two.
You're not competing with Dr. Graham, right?
Absolutely not.
Okay.
So this is more awareness and prevention. Dr. Graham and that's why we need to have partners, not to duplicate efforts, right? So this is more awareness and prevention, and we decided to combine both awareness months, because we're hoping that because women always come out, but we're hoping that the women are going to bring their partners out, so we can have a good mix.
I'm going to stop you and say men bring their partners out. And the reason why we're saying that is because we're speaking more and more about the LGBTQ plus population, right? We cannot be fearful in addressing that, because the more we are fearful in addressing it, the more that individuals are not going to want to even be diagnosed.
Right.
So we have to be open in conversations. We have to be honest with each other and ourselves as to what's going on in the community. True?
Absolutely,
In the
absolutely.
world.
Right, and to be inclusive.
Yeah,
It's
always.
so important to be
Right.
inclusive.
It's very important.
Absolutely.
You seem to have a lot going on, but there's one thing that you did this year that is going to establish a pattern for what you're doing. Tell us a bit about that.
Right. So we got some funding to establish a comprehensive cancer control program. And with that, it's exactly what it sounds like, all inclusive, all cancers, everybody. So collaboration, partnership, that's the focus through our coalition. So we had a cancer summit back in July where we brought all of our partners to the table. So we had different government agencies, and then we had the nonprofits. So a lot of them already were doing that cancer work, but everyone is kind of working in silos. And we're trying to get away from that. So that's the purpose of this funding, to be able to bring everyone together to leverage resources. Because right now, there's a lot of duplication of efforts, and then there are also gaps. So
First step in project management, right? Bringing the right people
At the table.
at the right time.
Yep. So that's the goal of this. And then the outcome is to have a comprehensive cancer plan for the territory.
That's where I wanted you to get
So-
it. Okay, good.
That is the outcome. And we are right now working, as a result of this summit, we've been having work group meetings with the different partners who attended. And we're wrapping those up early October, and then we're going to actually start writing. So based on what our partners are telling us they're seeing as priorities, what they want the objectives to be. So a similar process like what Dr. Valman explained with the CHA, the Community Health Assessment. So that's what we're working on specifically for cancer. And we're hoping to have, we're going to have
Yeah, thank you. Phrasing.
a completed document by January, and then implementation, because it doesn't end there. We want this plan not to just be on everybody's shelf. We're getting community input because we want everyone to own it as our plan, the community's plan, and then implementation. Now that's going to be tricky, but we're going to have to find a way to implement this plan, because then, we're going to require some funding. So that's where the partners come in, because yes, the Department of Health has some funding, but we can't do everything ourselves, and we recognize that. We rely on the partners.
And that's where it comes in terms of seeking more federal funding and grants and stuff like that. And we are hiring a health strategist for that simple reason. We got their permission for that,
Awesome.
so we're working towards that as well. So I think that's truly wonderful. And I have to tell you that one of the things that I was so touched by is that we had a group of survivors at the summit, at the planning meeting, and we could sit down as clinicians and say, even though many of our clinicians are survivors, we could sit down and say we're developing a plan, but you have to live it to feel it. You have to live it to know it. And so we actually were able to, we had at least 15 survivors there
About that, yes.
about that, who actually stood, spoke about family members, spoke about themselves. So I think that was awesome. Talk about inclusivity. That's truly one of the things that we need to do.
Right, and
Yeah, I was going to ask Linnea to kind of tell us the 4 work groups, because that's very telling in terms of how the group came up with the 4 different work groups.
Sure. So there's a standard layout for cancer plans, and many of the states, I should say all of the states, have cancer plans. So we are one of the last jurisdictions to come along in this process. So we're following the standard layout, and it goes along the cancer continuum of care, starting with prevention, which I really want to stress, because people don't link cancer prevention in their mind. Is all about survivorship and diagnosis and treatment. But we are starting with prevention and just trying to make the community be aware that there are some cancers that can be prevented through lifestyle factors like Dr. Graham previously mentioned. So we're focusing on obesity prevention, tobacco use, sun exposure, vaccines, because there are preventable cancers through certain vaccines.
And knowing risk factors, because remember, Dr. Graham indicated that just because you have not had, or because you're a man, and you haven't thought, okay, when my mother had breast cancer or ovarian cancer, that predisposes you for a risk for prostate cancer.
Absolutely.
So those are.
And I learned that this year because I was recommended for early screening because my dad is a survivor of prostate cancer. So he was like, well, you are at risk as,
that,
yeah. So I learned that. So when Dr. Graham said it, I was like, oh, look, my doctor knows what she's doing. Right. So yes. So the first work group is prevention. And then the second one is early detection. So that's, of course, key in diagnosing early and saving lives. And then treatment. And then last, survivorship and quality of life. So, yep, and in the survivorship and quality of life, there's still a prevention aspect. So, yes. And making sure, because yes, you have cancer, it may be in remission, but there's always a risk of reoccurrence. So, not because it's not, you didn't beat it officially, you know, so just trying to support survivors. A lot of the survivors who attended the summit are part of that work group. So, we're continuing to get their input on what should go in the plan to support survivors.
And it's important to do that because it reoccurs at times.
Yes.
And you have to be mentally prepared to accept that fact. It's not always easy, but it's something that needs to be considered. So now we spoke about the data a little bit. Where can we actually find the data? But before you go there, I would also like you to share where we can find the information that you shared. So don't forget that, okay? I'm going to go right back to you.
Sure. So we have 2 data sources that we use when planning, because this data is used to then plan our programs as well. So we have the cancer registry data, and that's available on the Department of Health's website. And then we have the behavioral risk factor surveillance system. So that's a mouthful.
But so wait, if you get a call from the Department of Health, it actually is a long survey, but I took it. It was detailed. So please, give us the opportunity to knowing more about you and taking the survey.
Yes. Absolutely, because that's where we're able to identify those health inequities or disparities, because then we're knowing a little bit more about your demographics, your social life, and then we can use it to then link the types of screening you're getting or not getting, and then provide social services through our community health workers. So,
and you'll hear the term BREFIS,
yes,
right? But it's actually
the Behavioral Risk Factor Surveillance System, and it's anonymous. So please do participate if you receive a call from us. It's legit. It's not a scam, and we use that data in our programs and planning, and then of course applying for additional funding for the territory.
And that's important.
Yep.
And we have to tell you that in the Department of Health, I'm so proud. We're securing more grant funding over and over. And that is because we're collecting, we're saving the data, and we're using the data for the benefit of the community. And that's critical. So, Dr. Valman, tell us a little bit about, we actually have 4 documents on the website. Tell us a little bit about what's on the website and how they can actually access.
Absolutely. Yeah, on the DOH website, under About Us, we do have a microsite called Reports and Plans. And that's where we are attempting to upload every plan, every document that we generate and produce in the Department of Health. Because you've heard that theme recur over and over. When we plan, we do not want them to sit on the shelf. They have to be used and implemented. So we do have our strategic plan, which gives us, the department, our roadmap of moving forward in terms of achieving our goals. We started the process of developing the Healthy Virgin Islands 2030 by first conducting a community health assessment. And that, in addition to the survey I mentioned, we use the BREFIS data, the Behavioral Risk Factor Surveillance Survey data. We use the cancer registry data as well. And those were instrumental in helping us identify priorities. The one we are very proud of, the Healthy Virgin Islands 2030, we then modeled on the National Healthy People 2030, where we identified our priorities and selected the objectives from Healthy People 2030 that we want to address here in the territory. And that is where we developed the process.
And then we also have a 2022 epidemiology report. And I have to tell you that I actually sent it to the governor and the county. It is so detailed, and it tells information not just about infectious disease, but in general what we're looking at in the territory.
Exactly.
So all of that data is used actually to support grant funding. Is really support our efforts here within the territory.
Right.
Because when we go in front of the Senate, we still have to prove ourselves as to what we're doing, how we're doing, which is good because of course that's part of the regulatory portion.
Right.
I know I said it's good, doesn't necessarily mean we want to be in the front of the Senate every day.
Yes.
Okay, but it's a pleasure really and truly to be able to provide to the community efforts like what you're doing in chronic disease, looking at how effective you've been
Right.
and how we can do. So we do have areas in which you can actually email, you can call in if there's some concerns that you have, so that we can help you more.
Right. I do have one more plan I want to bring everyone's attention. We do have the Youth Risk Behavior Survey
excellent.
that was conducted in 2018. We are looking to seek funding to do the next one, but it's really important that we also track the health status for adolescents. So that is a report that we are proud of. So please, whenever you need information, that DOH website is extremely informative. The documents are there. You can download them and use them. And like we do use these plans. And you can help hold us accountable. So please, please, please do go and research these documents.
And someone was actually speaking about the youth survey not too long ago, and looking and asking what we're doing in terms of the youth in our community. And so to know that we're doing those research is critical. Yes. So leave a message to the general public in terms of prostate cancer, what we're doing, what they can do. Remind them of what's going on this weekend as well as next week.
Sure. And for me, I just want to say, Dr. Graham kind of stated it, like we look at national trends, but our community is unique. So we have to look at what's happening locally and then make that decision. So men, I urge you, please look at your family history before you decide, I don't want to do prostate cancer, because it runs in families, it's hereditary. So please get screened. It's Prostate Cancer Awareness Month, yes, but it goes on beyond just the month. You know, it's an annual exam or biannual exam that you should have based on your risk. So please do make that appointment to get screened.
Thank you so much. Thank you both.
Thank you.
Always a pleasure to be in your presence.
Thank you for having us.
Thank you, Commissioner.
Thank you to our special guest, Dr. Emmanuel Graham, for sharing his information about men's health, prostate cancer, and other forms of cancer. I encourage men of all ages to attend Dr. Graham's event this weekend. Thank you to Deputy Commissioner Janice Valmont and Director Linnea Fredericks, who both continue to do great work in the Department of Health in the chronic disease prevention arena. Most of all, thank you for joining us this evening. We believe that every journey begins with a single step, and today you have taken that step. Remember, the power to prevent and manage chronic diseases lies within you. We want you to embrace your own power and to make choices that honor your well-being. We are here to guide you every step of the way. Your health, your responsibility. Have a wonderful evening, and we look forward to seeing you next time as we step into wellness.